men, depression globally is estimated about 5% of adults suffer from depression, and approximately about 280 million people in the world have depression. What are the symptoms and patterns? So depression is a reaction of the human body produced by the central nervous system. Due to its specific nature, depression is diagnosed in a large group of people, and it's one of the most common medical conditions. Depressed mood, such as feeling bad, irritated, or empty, or a loss of pleasure or interest in activities for most of the day, nearly every day, for at least 2 weeks. So this is the most frequent symptoms. And the depressive episode can be categorized as a mild, moderate, or severe, depending on the number and severity of symptoms, as well as the impact of the individual functions. What are the postpartum depression? Well, the postpartum depression is defined as the occurrence of depressive episode in the postpartum periods with a peak incidence between 3 to 6 months. Emotional problems of postpartum women are rooted in biological changes related to the course of pregnancy and childbirth. And in the early postpartum period, the woman's body is affected by sudden hormonal changes, falling estrogen levels after expulsion of placenta can cause affective or psychotic symptoms due to an effect of estrogens on the monoanergic system. At present, there are no diagnostic criteria for this disorder in men and no appropriate diagnostic tools. The reason this may be difficult a clinical picture of depression in men, whereas in women depressed mood and apathy predominate. In men, depression is most often manifested by irritability and isolation from the environment. The risk factors of postpartum depression is on this screen. The causes of postpartum depression in both men and women are not fully understood. Centrally, a huge role in the formation of pattern depression can be played by experience or of helplessness during childbirth. These are also symptoms of postpartum depression in men. So sadness, loss of interest, fear of future, feeling tired, insomnia, isolating, verbal or physical aggression, staying at work after hours, or self-destructive risky behavior. So aim of our study was to assess the life satisfaction and ability to cope with emotion in men whose partners show symptoms of postpartum depression assessed on the basis of Edinburgh Postnatal Depression Scale, which means they score over 11 points in this scale. Material and methods. The study involved 200 partners of women with symptoms of postpartum depression. Symptoms of the depression in the early puerperium were assessed on the basis of the Edinburgh Postnatal Depression Scale, and tools we used in our study was quartile emotional control scale, satisfaction with life scale, and also questionnaire for assessment of socio-demographic data. And as you can see, the majority of the survey group were men aged between 26 and 35 years old, with education other than higher. The men were working in relationship, they lived in the village, and also they were assessing their life condition as good. When we were analyzing the results of emotion control scale in men, we saw that the mean values obtained for all subscales were similar, and the mean values for anger control were a little bit higher than the others, and for the anxiety control was at the lower average. The study showed differences between employment and depression control scale. So working people presented a lower degree of suppression of depressive symptoms compared to non-working people. There were no differences between marital status, place of residence, and living condition comparing to control of emotion in the CSCC scale. The satisfaction with life of the survey men was on average level. The conducted study showed non-statistical impact of age, education, and employment on life satisfaction of the respondents. Also, there are no differences between marital status, place of residence, and living condition, and the level of satisfaction with life. So this is a summary. So the results of the study showed that socio-demographic variables affect the ability to control emotions in men in the postpartum period. The stereotypical prohibition on showing weakness and affection by men may lead to masking or downplaying emerging or worsening symptoms of depression. Postpartum depression in fathers is a poorly researched issue that requires further clinical research, including neurophysiological and social studies. The knowledge obtained in this way may contribute to effective primary and secondary prevention in the future. Finally, I would like to thank my colleague with whom this work was created. I hope that our further cooperation will be productive. Thank you for your attention, and if you want to start some cooperation with us, please contact me or Dr. Joanna on the below email addresses. Thank you.
Thank you so very much for that excellent presentation.
Thank you.
Are there questions